Ladies and gentlemen, welcome to my channel, Nursing Education Tutor. My name is Cheryl Spencer. So this is the pre-conference for February 2nd, and we'll start off with what's current. And yes, indeed, the coronavirus is still here. It's not leaving. As of last Friday, the World Health Organization issued a statement calling this a public worldwide public emergency. And again, as you know, the buzz with this started with the massive reports of infected individuals and even death in China, but it's not just with China. It's also some cases have been diagnosed in the United States, and it's a worldwide concern as individuals travel. Recently, some countries are limiting or banning flights to and from China in an attempt to reduce risk of exposure. Now, there's also some conversation, people talking about, oh, they're making it sound as if this coronavirus is new. Well, it's not new. I remember in 2018, some children in a hospital in New Jersey were diagnosed with what was believed to be the coronavirus. So this is not new. Viruses are not new. We're learning more about them, and of course learning ways to prevent us from getting sick from them, and also some have some fatalities. So again, the coronavirus is still in the news. Again, I have the CDC website here. I try to look at it every day to see if there's anything updated, as well as World Health Organizations, what they do. But these are the things that's part of healthcare. A couple of years back, it was the Ebola virus concerns, and for those of you who don't know, a nurse had gotten infected, and it was just it was a big mess, really. But it allowed us an opportunity to find out how we can better protect both the clients and the staff. And as I tell students all the times, the workplace must be safe for you too. You're not going into this as a martyr. You must use the guidelines recommended by OSHA, Occupational Safety, as well as Joint Commission, as well as recommendations from the Centers for Disease Control or any public health organizations that is their mission to protect both the individuals who work and the people that they serve. So again, the coronavirus is still here, and I don't think it's leaving for a minute. But as we go through this week, let's consider something else that never leaves us that we should talk about. So in this early week of February, I would like you to focus this week on HIPAA, how you protect patient records, patient confidentiality, and the word that you should always be mindful of when you discuss, share any information. Is it identifiable? If you're the nurse, does the doctor need to know? Yes. The social worker? Yes. The housekeeper? Yes, but limited. The housekeeper doesn't necessarily need to know the patient's diagnosis and how to care for them. So many things with, and many individuals, such as unlicensed assistive personnel, they don't necessarily need to know the patient's diagnosis, but they may need to know what type of precautions. Here's an example. If you have a patient who is in the hospital and they came with complaints of symptoms that are known to be similar to tuberculosis, and they're now in a private room on airborne precautions, the nurse's aide or housekeeper doesn't need to know that part. What they need to know is what are the precautions that would be on the door for someone with airborne precautions. They would know to use the respirator as opposed to the regular surgical mask and those types of stuff. So think about some ways this week on how we can protect patient confidentiality, and keep an eye out if you see any opportunities or any examples where you felt that somebody has violated patient's confidentiality. Have a discussion with your nurse educator, have a discussion with your peers, and just be mindful. As your educator, I have to protect your rights with FERPA. With students, you really also have to protect patients, rather, you have to protect their rights under the HIPAA guidelines. So this is a pre-conference for the week. I really hope that you have a wonderful week. As always, if this is your first time to my channel, welcome. I hope you stay. Have a good day.